Okay, the disease name hyperparathyroidism. Hyperparathyroidism is caused because of the increase in the parathyroid hormone, and this parathyroid hormone is secreted by the parathyroid gland, and this leads to increase in the calcium level in the blood, and which may disturb the calcium homeostasis. So these hyperparathyroidisms are classified into two types: the primary hyperparathyroidism and secondary hyperparathyroidism. Primary hyperparathyroidism is caused because of three reasons. The first reason is like because of the non-cancerous growth of adenoma, which is the most common one. The second one is the cancerous growth, which is a very rare one, and the third one is because of the overactive parathyroid gland, which may leads to increase in the parathyroid hormone, which may leads to increase in the elevated calcium level. Second one is nothing but like secondary hyperparathyroidism. The secondary hyperparathyroidism is caused because of some other reasons, for example vitamin D deficiency or chronic renal failure, or sometimes because of low calcium level in our blood. So biochemical basis of hyperparathyroidism. The biochemical basis of hyperparathyroidism is nothing but the disturbance in the serum calcium homeostasis. So kidney is a central organ which regulates the serum calcium homeostasis. Kidney not only helps in active calcium transport, but also helps in the maintenance and regulation of like serum calcium homeostasis by regulating or secreting the 1,25 dihydroxy vitamin D. And PTH receptors are widely spread in the renal tubule, which are like helps in the reabsorption of calcium and increased reabsorption of calcium, and also decreased reabsorption of phosphate, etc. This is a biochemical basis of hyperparathyroidism. Symptoms are nothing but the symptoms of hyperparathyroidism are nothing but tiredness, depression, and increased calcium levels. So bone density decreases, so frequent fracture, or all the symptoms of like hyperparathyroidism. Diagnosis is usually done by blood test, urine test, and also like bone density mineral test. So blood test to check also to check any elevation in the calcium in the blood level, and urine test to check about like urine which have any elevation or elevation in the calcium level. So mineral bone density tests to check the density of the bone. So these are the diagnosis of this condition. So coming to the population in India, the primary hypothyroidisms are spread more. So every 1 or 4 per thousand has this disease condition. So coming back to treatment, primary hypothyroidisms can be treated up by thyroidectomy or surgery. So in this, the surgeon has to remove the affected part of the parathyroid gland. So the parathyroid gland, sometimes if all the affected like 3 has to be removed, and some part is left behind for the normal functioning. And secondary hypothyroidisms can be treated up by taking like vitamin D supplements. Taking proper vitamin D supplements and also calcium supplements can able to cure this disease, and also like primary hypothyroidisms can be treated up by thyroidectomy and also by surgery.